Gastrointestinal pathology. Oral pathologies. Aphthous ulcers, also called canker sores. These are common oral lesions that appear as painful, shallow, round to oval ulcers covered by yellowish exudate. Recurrent aphthous stomatitis is associated with celiac disease, inflammatory bowel disease, systemic lupus erythematosus, Behçet syndrome, and HIV infection. Squamous cell carcinoma. This is the most common malignancy of the oral cavity. It usually affects the tongue. It is associated with tobacco use, alcohol, and HPV-16. It presents as a non-healing ulcer with irregular margins and raised borders. Leukoplakia, which is a white patch, and erythroplakia, which is a red patch, are precursor lesions. Coelolithiasis. This refers to stone formation in the major salivary gland ducts, such as the parotid, submandibular, or sublingual glands. It is associated with salivary stasis, such as dehydration and trauma. It presents as recurrent pre- or periprandial pain and swelling in the affected gland. Sialadenitis. This is inflammation of the salivary gland due to obstruction, infection, such as Staphylococcus aureus or mumps virus, or immune-mediated mechanisms, such as Sjogren's syndrome. Salivary gland tumors. These are usually benign and most commonly affect the parotid gland. Tumors of the submandibular, sublingual, and minor salivary glands are more likely to be malignant. They typically present as a painless mass or swelling. Facial paralysis or pain suggests malignant involvement. Pleomorphic adenoma, also called benign mixed tumor, is the most common salivary gland tumor. It is composed of chondromyxoid stroma and epithelium, and it recurs if incompletely excised or ruptured intraoperatively. It may undergo malignant transformation. Warthin tumor, also called papillary cystadenoma lymphomatosum, is a benign cystic tumor with germinal centers. It may be bilateral or multifocal. It is typically found in people who smoke. A mnemonic is "Warriors from Germany love smoking." Mucoepidermoid carcinoma is the most common malignant salivary gland tumor. It is composed of mucinous and squamous components. Achalasia. Achalasia is a condition in which there is failure of the lower esophageal sphincter to relax. This occurs due to degeneration of inhibitory neurons containing nitric oxide and vasoactive intestinal peptide in the myenteric or Auerbach plexus of the esophageal wall. It can be primary, idiopathic, or secondary due to Chagas disease from Trypanosoma cruzi infection or due to extraesophageal malignancies from either mass effect or paraneoplastic syndromes. Chagas disease can cause achalasia. Patients present with progressive dysphagia to both solids and liquids, in contrast to obstruction, which primarily causes dysphagia to solids. Achalasia is associated with an increased risk of esophageal cancer. Manometry findings include uncoordinated or absent peristalsis with increased lower esophageal sphincter resting pressure. Barium swallow shows a dilated esophagus with an area of distal stenosis, producing the classic bird's beak appearance. Treatment options include surgery and endoscopic procedures, such as botulinum toxin injection.